All right, let's talk about U.S. health insurance. It can feel, well, pretty overwhelming, right? But what if I told you there's a map? In the next few minutes, we're going to break this whole thing down. We'll chart out the main pathways to getting coverage so you can figure out the route that's actually right for you. I mean, seriously, have you ever started looking at healthcare plans and just felt completely lost? All the acronyms, all the rules. It's like being dropped into a giant, confusing maze with no exit signs. And trust me, if that sounds familiar, you are definitely not the only one. Well, that's exactly what we're here to do today. Think of this as your map. We're going to break down the whole system into its main pathways, just so you can see the landscape clearly and, find the route that actually works for you. Okay, so our first major pathway on this map, it's all about the plans that are directly connected to the government. These are huge programs. They're basically the foundation of coverage for millions and millions of Americans at all different stages of life. So two of the biggest names you'll hear in this space are Medicare and Medicaid. It's easy to get them mixed up, but the key difference is really simple. It's all about who they serve. Just think of it this way. Medicare is mainly for seniors, so people 65 and older and some folks with disabilities. Medicaid, on the other hand, is all about providing free or low-cost coverage for people and families with low incomes. But here's the thing about Medicare. It isn't just one single plan. It's actually broken down into 4 parts. You've got Part A, which is your hospital coverage. Then there's Part B for doctor visits and outpatient stuff. Part D, that's for your prescriptions. And then there's this other one, Part C, which is kind of an alternative that bundles a lot of these benefits together, usually through a private company. Okay, so that's Medicare and Medicaid, but there's another really crucial set of government-related plans we need to talk about. These are specifically designed to support those who've served in the military and, of course, their families. The 2 main programs you'll hear about here are TRICARE and CHAMPVA. TRICARE, that one's for active duty service members, retirees, and their families. CHAMPVA is a bit different. It's specifically for the families of veterans who are either disabled or have passed away. The goal for both is to make sure the military community has access to affordable health care. All right, let's move on to the next section of our map. And this is a big one. It's the path most people in the U.S. take, getting your health insurance right through your job. So when you get insurance through work, you're probably going to face a pretty big choice right off the bat. And it really all boils down to one simple question. How much flexibility do you want when it comes to picking your doctors and hospitals? And that choice usually comes down to a classic trade-off. You've got your HMOs, which usually cost less, but the catch is you have to use doctors inside their specific network. Then you've got PPOs, which give you a lot more freedom to see providers both in and out of that network, but you guessed it, that flexibility usually comes with a higher price tag. Now, something else you should probably know about is workers' compensation. This isn't your main health plan, not at all. It's a totally separate insurance your employer provides that kicks in only if you get injured or sick because of your job. It covers your medical costs and even lost wages in that specific situation. Okay, but what happens if you leave your job? That's a huge question, right? Well, that's where something called COBRA comes in. And it's not a new insurance plan itself. It's actually a law that lets you stay on your old employer's health plan for a little while. Think of it like a bridge that makes sure you don't have a dangerous gap in your coverage. All right, so we've covered the government path and the path through your job. But what if you're not on either of those? This last section of our map is for everyone who needs to find their own way. I'm talking freelancers, small business owners, or any family that needs to go out and buy their own plan. For a lot of people in that boat, the place to start is the ACA Marketplace. You've probably heard of it. It was created by the Affordable Care Act, and it's basically a resource designed to make the whole process of finding and buying your own health insurance, well, a lot easier. The best way to think about it is like an online shopping center, but for health insurance. It's set up for individuals and families to go in, compare a bunch of private insurance plans, and then buy one. And a really key feature here is that a lot of people can get subsidies, basically financial help to make those plans way more affordable. Okay, so we walked through the 3 big paths, the government route, the employer route, and the individual one. Now, let's just take a step back and talk about why all of this really, really matters. Why having this map is so crucial for getting where you want to go, which is, good health and financial peace of mind. Because here's the bottom line. Understanding all these options gives you power. It's the power to choose a plan that actually fits your life and your budget. It's the power to protect yourself and your savings from those scary surprise medical bills. And maybe most importantly, it's the power to make sure you can get the essential care you need exactly when you need it. So we've laid out the main roads and the big landmarks on the map. Look, the system is still complex for sure, but hopefully it doesn't feel like a completely uncharted maze anymore. You've got the map, so the only question left is,